Welcome to Adaptive Medical Partners. I'm Matt Davis, Director of Brand Marketing and Communications. Joining me today is Tim Ketterman, our VP of Operations. This is the first of a four-part series, and we're going to be discussing the state of physician recruiting today. So before we dive into the state of physician recruiting, Tim, can you just give us kind of a real quick recap of kind of 2018 and what you and your team saw?
Sure. I mean, obviously lots of trends, lots of interesting things have changed in the market. I think what we've seen the most is that the physician shortage, which everyone's talking about, has really impacted physician recruiting in a lot of different ways. But it's been something that's been in the public for a while, so we've seen organizations starting to adjust and accept it. But the desire and need to really put out some pretty dynamic strategic recruiting strategies to overcome this shortage is still imperative to succeed.
So what in 2018 was the most surprising thing that you came across that you were just, your mind was kind of like, wow?
I don't know if it was surprising or my mind was blown, but I think it was somewhat expected. But one thing that we did see, which you would expect when you're in a shortage market like this, is the number of offers that candidates are now considering before moving to the decision phase. On our side, probably increased by about 250% from years in the past. So that's been a pretty big challenge when you're trying to recruit in this market, because you're dealing with multiple offer situations where previously there might have been 2 to 3 offers. Now we'll see 7, 8, 9, 10 offers that one candidate's exploring.
So much tougher for the physician to make that decision.
It's not surprising that they're indecisive because they have so many options. So you add the indecisiveness with sort of an interesting trend that organizations have actually become slower at making their own decisions, and you put that all together with the physician shortage, and you get a lot of delays and a lot of challenges to creating great outcomes.
Gotcha. So I guess it would be safe to say with there being more jobs than physicians, it's really a buyer's market for the physician right now.
You could say that, although the organizations that we work with wouldn't want to hear that. But anytime that there's more supply than there is demand, the supply side of the curve is in control. And the physicians really, or the candidates I should say, really are a little bit more in control of this process than has been in the past. So that's definitely been a trend that we've seen.
Awesome. So moving on to the state of recruiting as it is today, we talked about the shortage a few minutes ago. Diving into that a little bit deeper, the AAMC predicts a shortage of anywhere between 34 to 88,000 physicians by 2025. I know that's a very broad statement, but what does that really mean as it relates to the patient, the physician, and the administrator?
Well, for the patient, obviously it's access, so they don't have as much access as you would like them to have. And there's been estimates that it's actually as high as 105,000 and even up to 125,000, estimated down to 105,000. So it really depends on where you're going to look for your numbers. For the administrators, it's really about managing the future of their provider staffing, because we've got older physicians that are getting ready to retire, so you've got retention planning, which should become a strategy as well, but you have to sort of figure out where that magic point is to when you start recruiting. And the reality is, in today's market, you're always recruiting.
Right. Perfect. So what should administrators be doing today to best position themselves for what's already happening and what's going to be coming in the next few years?
Sure. Well, the important thing is that the organizations that are succeeding in this market have accepted that it's the way that it is. And they're not trying to fight against it and use that as a reason why it's becoming a challenge to recruit. And that's really what dynamic strategies are necessary for. Finding the candidate in a shortage market you think would be difficult. We're finding candidates. I think the important thing, the administrators who are winning the battle, is what do you do with that candidate when you find them? What's that experience from the point where you first present them to get them convinced to come on site to interview, to go through the interview process and close? That's where the winners are win, and that's where the organizations that aren't having the great outcomes are usually deficient, is that experience and cleaning up those systems and making them more efficient.
Awesome. So how does this shortage affect physician recruiters, and how can they take steps to mitigate it as well?
Well, that's a great question. That's obviously what we do. So first off, if you've got to have a sound strategy in place. You have to know what you're doing before you even take it to market. We highly recommend with all of our partners that we work with that 90-95% of the job be done before you even bring it to market. Know what your compensation is going to be, know what the job description is, be flexible along all of those things, create opportunities for people to maybe kind of tailor make their particular practice to their desires, because quality of life is a very important aspect to the recruiting game as well. But really focusing on the systems and the process in which you're recruiting a physician, so their experience is as positive as possible, and realize the net benefit is a positive outcome for them, you're going to win more than you're going to lose in the recruiting battle.
Okay, awesome. Well, Tim, thanks for your time today. Make sure and join us next week as we talk about the actual recruiting process.